Yeah, so I think, and this goes back to the original history that was provided and why we got where we are. When we started Case for Quality and we're really looking to engage, and the paradigm there is really looking to shift the dynamic towards a focus on what is going to deliver the best outcome for the patients, right? How do we get to those objective tangibles? How do we enable better control, better data, better visibility? Something that would enable a complete shift in terms of decision-making for the agency. As we got out there, again, technology wasn't being adopted, it wasn't being utilized, implemented. This was a huge barrier, but, this is foundational. Clearing the path for enabling these technologies is key to a lot of the direction the agency wants to go and the impact that might have for patients, for business, the future in general. We're looking at activities that we're trying to engage right now, especially relevant to the COVID-19, on supporting advanced design and manufacturing practices, stuff that could actually create much faster paths to better production, better product out on the market, things that can help even ease some of the pandemic stress. Foundationally, the technology, the support systems aren't there. Better manufacturing, better processes, digitalization in industry, a big priority for the agency now. We talk about AI, machine learning, impact of SAMD, what that could do. The foundational technologies and the data needs to be there. The shift to real world evidence, bringing down the need for, huge costly clinical trials, having better information than what the clinical trials give out. Better characterization of risk of product in the field, all the potential that brings with it, the value of the patient input. Foundational technology needs to be placed, right? That needs to be working. People have to be committed to gathering the information, the data, and having the systems to ensure that. All our Case for Quality efforts, the voluntary improvement program, we're talking now about, the medical device information analysis sharing platform to really bring the whole community together to share information and tackle problems. Organizational metrics, a different way of looking at what's happening, the software pre-certification program. These are all real changes that the agency is looking to make that are really dependent on the commitment to technology and the information and data that comes out of it.
The focus here, and Cisco, I'm gonna definitely use your, because you've heard it from all of us, from all the webinars and conferences that we've been doing together. So again, there's a lot of barriers here. And then I think we mentioned some of it already about paralyzing the industry from really automating, right? So Cisco, if you just want to take a few minutes here.
Oh, we've heard a lot of these to begin with. I think so many of them that are real favorites to me, especially when you take them into their tangible examples when people share with them. Everything is high risk. That's a big one, right? And you hear it, you see it in terms of how organizations approach or get pushed back on whenever they're trying to make a change. That oftentimes goes hand in hand with the one right next to it, which is, validating that software piece as if it were the product. There's this whole confounding of that risk that is happening. The documentation, especially in an era where we're reliant, and it would be so much better to have the data, the documentation per se, the record reside as usable, discrete data elements that can be leveraged and tracked throughout the system. Going along with that, my favorite is the screenshots. Let's not even go on that topic right now. We'll do that another day. There's just a lot of information that we've been hearing, and these are just I think, tip of the iceberg of what's going on there, but there's some of the big pain points that we've heard. And the idea of this taking 4 times longer to implement when every other industry uses these technologies, adapts them, they are in place, and they all have their due diligence that's done. They all make sure there's rigor in making them work for their business. But there's nowhere this overhead that goes along with that. And I don't think that was ever our intent for that to happen, especially when we're talking about these activities. The effort should be in where there might be a risk introduced by that. The effort should be in, when you've decided to design this into a product, that's where you really are putting a lot more rigor. I think we can be collectively smarter about how we approach these processes end, what we consider valid and assured for its intended use.